When I've recommended it to other colleagues, for example, and others have called my office and just found out that I had one, and they've contacted me just inquiring, asking me how my results have been and what do I think about it and so on. I strongly recommend it, of course, to every chiropractor or physical therapist that I've ever talked to about it. And it's been surprising for me that the number one concern, I think, that I've been hearing from colleagues in my own profession is they're almost concerned that they're going to need to go out and find more new patients because they're fixing people faster. So they're worried that it's going to even affect their business model. And so I've had people ask me, well, maybe I'll have to raise my fee structure since I won't see them as many times. My answer is always the same, which is it's a non-starter. It's a nonsensical concern. To give you an example, I hired my first associate in 2009, and I stopped taking new patients, and I went over 5 years without taking a single new patient, and I was full every day just because I have so many people out there. And then I hired a second associate, and now I'm taking new patients again for the first time in almost 6 years, and it's only because of the photobiomodulation. I've been able to get longer lasting results with people that have been in chronic pain for even decades. And so people that used to see me every 2 weeks or every month or what have you, just to minimize their pain, now see me quarterly or less often, or not at all, because they don't need me anymore, which is pretty fantastic. So first of all, in a clinical standpoint, it's always better if you can actually repair something, if you can actually fix a problem and not just alleviate it or cover it up. And that should be obvious to any clinician. But also, the concern about needing more and more new patients is it takes care of itself. I've always had 100% referral practice. I've never advertised in 20 years, and I've never had any sort of gimmicks. I don't use a cookie cutter approach. Even when yellow pages were utilized before the internet was around, I never had yellow page ads or anything. It was 100% word of mouth. For years, I never had a sign on my building. The only way you could find out about me is if somebody handed you a card or literally gave you my number. And so I've always felt that I needed to hold myself to that standard. If I was doing great work, then I shouldn't have a problem with new patients. I've been fortunate that way to succeed that way. But now it's just a whole other level with the addition of photobiomodulation, because my results are so much better and so much faster. So it's faster, it's better, it's cheaper for the patients, and you get longer lasting results. And so those who have that experience, they can't stop talking about it. And so the new patient influx is going to go through the roof. You're going to have as many new patients as you can handle if you're actually fixing people. Seems like that should be self-evident, but a lot of people are concerned about that, and I've had to even sort of persuade some of my other colleagues that that is the way that it's going to be. If you really get great results, then you're never going to have to advertise, and that's exactly what I've always found, and I'm getting better results now than I ever have in 20 years of practice.